There is a lot of debate right now regarding the optimal timing for initiating a treatment for patients with myeloma, because we are moving into the definition of myeloma. We used to treat patients that were supposed to be symptomatic according to the CRAB criteria with hypercalcemia, anemia, bone pain, etc., and renal impairment. But we are now defining a group of patients with smoldering myeloma, so a true myeloma with more than 10% of plasma cells within the bone marrow that are very high risk of progression within 2 years. And we are considering that if these patients, this subgroup of patients, is supposed to progress very, very quickly, maybe we need to treat them earlier. So we are now moving to treatment earlier in the course of the disease for these patients with a true myeloma, but with a very high risk of progression. So I think that we are now treating patients earlier, and we are not speaking about symptomatic myeloma. And there was a very recent paper published by the International Myeloma Working Group modifying the definition of myeloma. We are not speaking about symptomatic, we are speaking about myeloma defining events. So without a symptomatic myeloma, if you have a high risk of smoldering, you need to be treated. We are now considering that patients with smoldering high-risk myeloma should be treated maybe like other patients, but if they have a very, very high risk, ultra high risk of progression, let's say. And so the definition is that you don't need to have symptoms, but you need to have more than 60% of plasma cells within the bone marrow, or to have a free light chain ratio of more than 100, or to have more than one bone lesions on MRI. In this situation, you can treat your patients like you are treating all other symptomatic patients. For other patients with smoldering, we need clinical trials, and we have different options. And the Spanish group, for example, compared lenalidomide and low-dose dex versus no treatment. And we do have phase 2 trials with more intensive treatment. In US, we've heard about the results of Carfil, lenalidomide and low-dose dex, so a triplet combination, KRD, in high-risk smoldering with very, very good results on a small number of patients. But the results are quite interesting. And we will have very soon another study that will be performed in high-risk smoldering patients, including stem cell transplantation, and this study will be run in Spain.